One second, I'm sorry. Our topic for today is Zika virus. Quote of the day is to succeed in life, you need two things, ignorance and confidence. My name is Rita Sharam Sarva and my professor is Professor Dr. Saira Afzal. Our learning outline is introduction, history of Zika virus spread, global situation, which countries are affected, signs and symptoms, modes of transmission, key facts, treatment, prevention, WHO response, recent advances, and MCQs. Learning outcome. At the end of the presentation, participants will have a broad overview of Zika virus disease, its spread, risk factors, clinical manifestations, its vector, modes of transmission, along with knowledge of effects in pregnancy, complications, and lastly, treatment prevention. Introduction. Zika virus is a member of the virus family Flavivirdi. It is spread by daytime active Aedes mosquitoes such as Gypsy and Alopticus. Asian tiger mosquito also causes Zika virus. Its name comes from the Zika forest of Uganda. The Zika virus is a mosquito-borne viral infection that primarily occurs in tropical and subtropical areas of the world. Most people infected with Zika virus have no signs and symptoms, while others report mild fever, rash, muscle pain. Other signs and symptoms include headache, red eyes, and a general feeling of discomfort. Zika virus infection during pregnancy has been linked to miscarriage and can cause microcephaly, a potentially fatal congenital brain condition. It may also cause other neurological disorders such as the Guillain-Barré syndrome. Researchers are working on a Zika virus vaccine. For now, the best prevention is to prevent mosquito bites and to reduce mosquito habitats. Its clinical manifestation is often similar to dengue, and it is also often spread by the same vector. It presents as mild fever, rash, headaches, arthralgia, myalgia, asthenia, and non-purulent conjunctivitis, occurring about 2 to 7 days after the bite of the infected mosquito. History. In 1947, scientists conducting routine surveillance for yellow fever in the Zika virus of Uganda isolated the Zika virus in samples taken from captive sentinel rhesus monkey. 1948, the virus is recovered from the mosquito Aedes africanus caught on a tree platform in the Zika forest. And 1952, the first human cases are detected in Uganda and in Tanzania in a study demonstrating the presence of neutralizing antibodies to Zika virus in sera. 1969 to 1983, the known geographical distribution of Zika expands to equatorial Asia, India, Indonesia. 2007, it spreads from Africa and Asia to cause the first large outbreak in humans on the Pacific island of Yap. And in 2003 to 2004, it starts to spread in the Pacific Islands, French Polynesia, Easter Island, Cook's Island, and New Caledonia. The global situation in 2007 and then 2015 is that in 2007, the Americas reported the first outbreak in the Yap, and in 2015, the WHO recorded the first local transmission in the region of Americas identified in Brazil. And in Brazil reported an association of Zika virus with the Guillain-Barré syndrome. And then on the 2nd of March 2015, Brazil notified WHO of reports of an illness categorized by skin rash in northeastern states. On February 2016, WHO declares the recent association of Zika infection with clusters of microcephaly and other neurological disorders, and it constitutes a public health emergency of international concern. WHO declared Zika virus as a public emergency of international concern on the 1st of February, following report of clusters of microcephaly. And then on 2016, an emergency committee of WHO felt that Zika virus and associated consequences remain a significant enduring public health chain requiring intense action but no longer represent as a public health emergency. Many aspects of this disease and associated consequences still remain to be understood, but this can be done through research. The emergency committee recommended to escalate it into a sustained program of work with dedicated resources to address the long-term nature of disease. Epidemiology. Its agent of Zika virus is an emerging arthropod-borne virus transmitted by the Aedes mosquito. The virus belongs to the genus Flavivirus family, which is the Flavivirdi, and is closely associated with flaviviruses including dengue, chikungunya, yellow fever, and West Nile virus. It is a single-stranded RNA virus with a genome of 10,794 kb length, and two lineages have been discovered, African and Asian. Reservoir of infection is unknown. Immunity: once a person has infected, she is likely to be protected lifelong. Vector is that it is transmitted by the Aedes aegypti mosquito, Aedes alopticus, may also transmit the disease, and Aedes helensii was a predominant vector species identified in the YAP outbreak. Transmission primarily transmitted through the bite of an infected Aedes species mosquito. Extrinsic incubation period is 7 to 10 days. Maternal to fetal sexual transmission from an infected person to his/her partner's blood transfusion. There are no reports of transmission of Zika through breastfeeding. Zika virus has been detected in breast milk. Based on available evidence, the benefits of breastfeeding outweigh any possible risks of this mosquito. In pregnancy, it can be spread by vertical or mother-to-child transmission during pregnancy or delivery. An infection during pregnancy has been linked to changes in neuronal development of the unborn child. Severe progressions of infection have been linked to the development of microcephaly in an unborn child, while mild infections can lead to neurocognitive disorders in adulthood. Congenital brain abnormalities other than microcephaly have also been reported after a Zika outbreak. Blood transfusion. 2 cases of Zika transmission through blood transfusion have been reported globally, both from Brazil, after which the U.S. Food and Drug Administration recommended screening blood donors and deferring high-risk donors for 4 weeks. Diagnostic testing. Zika virus diagnosis can only be confirmed by lab testing for the presence of Zika virus in the blood or other body fluids such as urine or saliva. It is diagnosed through RT-PCR. Typically, the development of virus-specific IgM and neutralizing antibodies occurs towards the end of the 2 to 7 days of illness, and it can either cross-react with other flaviviruses such as dengue, West Nile, and yellow fever, which can make the diagnosis by serology difficult to discern. Clinical features. An estimated of 80% of people who are infected with Zika are asymptomatic. In the majority, it is a self-limiting disease. The symptoms are similar to other arboviruses such as dengue and include fever, skin rashes, conjunctivitis, muscle and joint pain, malaise, and headache. These usually last for 2 to 7 days and are usually mild. Other reported symptoms are dizziness, edema on the extremities, retroorbital pain, anorexia, photophobia, gastrointestinal disorders, sore throat, cough, aphthous ulcers, back pain, sweating, and lymphadenopathies. None of these symptoms are specific and can be misdiagnosed with other bacterial and viral infections. Incubation and viremia. Incubation period is 3 to 14 days and ranges from few days to 1 week. Some infected pregnant women can have evidence of Zika in their blood longer than expected. Virus remains in serum, semen, and urine longer than 3 to 14 days. Most symptoms are asymptomatic and include maculopapular rash, conjunctivitis, muscle pain, headache, and its disease and outcomes include that it is usually mild and can last several days to a week. Severe disease requiring hospitalization is uncommon and fatalities are rare. Birth defects like microcephaly, neurological complications like Guillain-Barré syndrome are temporarily associated with the outbreak. Researchers are studying potential but unproven link between the surge of Guillain-Barré cases and Zika virus infection. There is no evidence that prior Zika virus infection poses a risk for birth defects and complications for future pregnancies. Treatment. There is no specific treatment available for its infection or associated diseases. Symptoms of Zika virus are potentially mild. People with symptoms such as fever, rash, or arthralgia should get plenty of rest, fluids, and treat fever with common medicines. If symptoms worsen, they should seek medical care and advice. Pregnant women living in areas with Zika transmission or those who develop symptoms of Zika should seek medical attention or lab testing and other clinical care. Prevention. There is no vaccine to protect against it. The CDC recommends all pregnant women to avoid traveling to areas where there is outbreak. If you have a partner who lives or has traveled in an area where there is outbreak, CDC recommends abstaining from sex during pregnancy or using a condom during contact. If you're trying to become pregnant, talk to your doctor about any upcoming travel plans and the risk of getting infected with Zika. Your doctor may also suggest that you and your partner try to wait several months to conceive. During sexual contact, use a condom to avoid the risk of getting or spreading Zika virus if you or your partner lives in an area or has traveled to an area of outbreak. If you are living or traveling in tropical areas where it is common, the tips may help to reduce spread. Stay in air-conditioned or well-screened housing. Wear protective clothing. Wear long sleeve shirts, long pants, socks, and shoes. Use mosquito repellent. When used as directed, mosquito repellent is registered with the EPA and are proven safe and effective for pregnant and breastfeeding women. And then reduce mosquito habitat. The mosquitoes that carry Zika virus typically live in and around houses, breeding in standing water that can collect in such things such as animal dishes, flower pots. Use automobile tires. Reduce breeding habitats to lower mosquito populations. CDC statement on May 13th was that scientists have concluded after careful review of existing evidence that Zika virus is a cause of microcephaly and other severe fetal brain defects. In the report published in the New England Journal of Medicine, CDC authors described a rigorous weighing of evidence using established scientific data. This study marks a turning point in Zika outbreak. It is now clear that the virus causes microcephaly, and we are also launching further studies to determine whether children who have microcephaly born to mothers infected by Zika is the tip of the iceberg of what we could see in damaging effects on the brain and other developmental problems, said Tom Fredrin, who is the director of CDC. We've now confirmed that mounting evidence suggesting affirming our earlier guidance, pregnant women and their partners to take steps to avoid Zika infection, and healthcare professionals who are talking to patients every day. We are working to do everything possible to protect the American public. WHO response. WHO supports countries to conduct surveillance and control of arboviruses through implementation of Global Arbovirus Initiative, which is aligned with and expands upon recommendations laid in the Zika Strategic Response Plan. WHO responds in the following areas: supporting countries in the confirmation of outbreaks through its collaborating network of laboratories, providing technical support and guidance to countries for effective management of mosquito-borne disease outbreak, reviewing the development of new tools, including insecticide products and application of technologies, formulating evidence-based strategies, policies, and outbreak management programs, supporting countries to improve their reporting systems, providing training on the clinical management, diagnosis, vector control, and the regional level with some of its collaborating centers, and publishing guidelines and handbooks on epidemiological surveillance lab, clinical case management, and vector control for member states. Recent advances. A review on Zika virus outbreak, epidemiology, transmission, and infection dynamics. Zika virus is a newly emergent relative of the Flavividae family and linked to dengue virus and chikungunya. It is one of the rising pathogens promptly surpassing geographical borders and was characterized by mild disease with fever, headache, rash, arthralgia, conjunctivitis, with exceptional reports of any association with Guillain-Barré syndrome and microcephaly. However, since the end of 2015, an increase in the number of GBS-associated cases and to an astonishing number of microcephaly in fetus and newborn in Brazil have been related to Zika virus infection, raising serious worldwide public health concerns. It is transmitted by the bite of an infected female mosquito of 8 species. Clarifying such worrisome relationships is thus current unavoidable goal. Here we extensively describe the current understanding of the effects of Zika virus on health, clinical manifestations, diagnosis, treatment options based on modern, alternative, and complementary medicines regarding the disease. The knowledge of Zika virus transmission and its prevention among high-risk pregnant women in Brazil. Recent outbreaks of Zika virus infection highlight the urgent need to evaluate the efficacy of current public health measures to educate susceptible groups about how to prevent infection. Modes of transmission, viral transmission, and consequences of infection. We performed a cross-sectional study in the city of Juandeo, Sao Paulo from March 2016 to August 2017. In 315 high-risk pregnant women, we evaluated the rate of Zika virus infection, knowledge of pathways of Zika virus infection transmission, and the use of protective measures. Data were analyzed and correlated with socio-demographic variables. The rate of Zika virus infection was 10.8%, and transmission by mosquitoes was best known means of virus acquisition, while transmission by sexual intercourse as well as mother-feeder transmission was known by less than half of the women. The use of insect repellent reported by 53% of participants was correlated with higher education and personal directives from health professional. Condom use was reported by 19.5% of subjects. Improved strategies to increase awareness of Zika virus infection and its consequences designed to appeal to specific targeted populations are clearly necessary to more accurately prevent the spread of this infection and diminish adverse consequences in the pregnant population. Now getting to MCQs. Question number 1. The Zika virus is a mosquito-borne viral infection that primarily occurs in the tropical and subtropical areas of the world. Most people infected with the Zika virus have no signs and symptoms, while others report mild fever, rash, and muscle pain. Which of the following population are at the highest risk of complications from Zika virus? A. Children under 5 years of age. B. Elderly individuals over 65 years of age. C. Pregnant women. D. Individuals with a weakened immune system. Or E. Men suffering from heart disease.
D.
D.
The answer is C, pregnant women. Question number 2. WHO declared Zika virus as a public health emergency of international concern on 1st February 2016. In what regions of the world has Zika since then been reported? A. Only in South America. B. Only in Africa. C. Only in Asia. D. In multiple regions of South America, Africa, and Asia. Or E. In Europe.
D.
Yes, the answer is D. Question number 3. AIDS mosquito is a common vector to transmit the viruses that cause dengue, chikungunya, West Nile fever, and Zika virus. An infected female AIDS mosquito acquiring the virus while feeding on the blood of an infected person, and then viruses are passed on to healthy humans through its bite. What is the typical incubation period for Zika virus? A 1 to 3 days, B 3 to 5 days, C 5 to 7 days, D 7 to 14 days, or E 20 to 25 days.
D.
Yes,
D.
yes, the answer is D. Question 4. An estimated 80% of people who are infected with Zika virus are asymptomatic. In the majority of cases, Zika virus is a self-limiting disease. The symptoms are similar to other arbovirus infections such as dengue. What are the symptoms of Zika virus? A. Fever, rash, joint pain, red eyes. B. Chest pain and shortness of breath. C. Vomiting and diarrhea. D. Headache and back pain. E. Bluish discoloration of fingernails.
Alpha.
A.
Yes.
A.
A is the answer. Question 5. Scientists conducting routine surveillance for yellow fever in the Zika forest isolate the Zika virus in the samples taken from captive sentinel rhesus monkey. In 1948, the virus is recovered from the mosquito Aedes africanus caught on the tree platform in Zika forest. Zika virus was named after the Zika forest of which country? A. Nigeria, B. Angola, C. Uganda, D. Zimbabwe, and E. Colombo.
A.
The answer is C, Uganda. It's Uganda. Question 6. Zika virus is an emerging arthropod-borne virus, arbovirus transmitted by Aedes mosquitoes. It is a single-stranded RNA virus with a genome of 10,794 kb length. Two lineages have been described, African and Asian. What type of virus is it? A. Retrovirus, B. Flavivirus, C. Coronavirus, D. Orthomoxy or E. Influenza virus.
B.
B.
Yes, the
A.
answer is
D.
B is the answer. Question 7. There is no treatment available for Zika virus infection or its associated diseases, but it can be prevented and symptoms can be relieved to a certain extent. What is the most effective way to prevent Zika virus? A. Wearing long sleeve clothing. B. Using insect repellent. C. Avoid traveling to affected areas. D. Reduce the breeding habitat to lower mosquito populations. And E. All of the above.
A.
E.
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 Yes, E is the answer. Question 8. Zika virus is a member of the virus family Flavivirdi. It is spread by daytime active Aedes mosquitoes such as Aedes aegypti and allopticus. Which of the following can also transmit Zika virus? A. Southern house mosquito. B. Anopheles mosquito. C. Culex mosquito. D. Asian tiger mosquito. Or E. Culex salus mosquito.
B. Peter.
B. B.
It's which can also transmit it. So the answer is D. Asian tiger mosquito. Question 9. Zika virus can spread by vertical or mother-to-child transmission during pregnancy or at delivery. An infection during pregnancy has been linked to severe changes in neuronal development of the unborn child. Severe progression of infection have been linked to the development of what in an unborn child? Spina bifida, Down syndrome, microcephaly, clubfoot, or hemophilia?
C. 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 C.
Charlie.
C.
Yes, C is the answer. Question 10. Zika virus presents as mild fever, rash, headaches, arthralgia, myalgia, asthenia, non-purulent conjunctivitis. Its clinical manifestation is similar to what disease also spread by the same vector? A. Dengue, B. Coronavirus, C. Chickenpox, D. Swine flu, or E. Lyme disease.
A.
A.
The answer is A. Dengue. This is the key. These are my references, and this is the link to the YouTube channel.
Okay, thank you very much, Dr. Rida. Very nice presentation on a very difficult topic, Zika virus. As we know, that it has caused lot of miseries, especially in Africa, where it has been found to be greatly associated with anencephaly and microencephaly. It is a very difficult topic, but you have covered it very well. Thank you very much, everyone, for your participation. And we have really learned a lot today. And best of luck for your test on Saturday. Thank you very much, everyone. Allah Hafiz. See you next time.
Thank you, ma'am.
Thank you, ma'am.
Thank you,
Allah
ma'am.
Hafiz.